Good morning, everybody. Welcome to another meeting of the Maryland Transit Caucus. On our last meeting, we had a robust conversation about the public-private partnership and a desire to take some action on that. And Delegate Learman circulated a letter. I spoke to Delegate McKay about my perhaps overly sensitive concern to make sure that people who had a different view on the project had their chance to express that. And Delegate Learman and Delegate McKay came up with an approach that is in your inboxes. So make sure you take a look out for that. Our speaker this morning is Chrissy Nizer, who is the, among other things, the administrator of the Maryland Motor Vehicle Administration. And she is also the head of the Maryland Highway Safety Office and the Vision Zero coordinator, which is the capacity we invited her here today. Although if you're having problems with your license renewal, maybe she can advise on those as well. But obviously there's a lot of connectivity between transit and walkability and Vision Zero. And so we'll turn it over to Administrator Nizer.
Yeah, thank you, Doug Corman. I really appreciate you inviting me to attend and to talk about Vision Zero and where we really are in terms of the state. I am trying to share my screen, but it looks like I'm not currently allowed to. Getting a message.
Right.
It says host disabled participant screen sharing.
Can you try it again?
Sure. There we go. Perfect. Thank you. All right. Everybody see my screen okay?
Yep.
Good. All right. Great. So yes, as the introduction said, we are very focused in Maryland on Vision Zero, and I know many of the members of the Transit Caucus are very active in these highway safety issues and pedestrian safety issues, and I certainly appreciate your support because we always say, this is something that's really done by partnerships. It's not done by any individual group or agency. So that's why I'm really excited to be here today. I really like this chart because I think it's a helpful way to see that policy and evolution of technology really does make a difference, and so this is just a nice review, and I'll share these slides with you too afterwards if you'd like. I can provide them. I just think as people talk about different policy decisions and whether they make a difference or not, you can see some of these critical things that happen, and as well as the economy, right? Certainly as the price of gas increases and if there's an economic downturn, there's also oftentimes a corresponding change in the number of fatalities that we wind up seeing on our roadways. So here's our fatality number as well as our fatality rate. That is something that we are required to report to the federal government. You can see that 2014 was really our biggest drop that we've seen during this period of time, and since then, unfortunately, we've been moving a little bit in the wrong direction. I will say that the 2020 numbers are not quite ready yet. I know there's been some local numbers that have been released. The Maryland State Police is under statute, the entity that is in charge of crash data, and we work with them in terms of the analysis. They provide local agencies an opportunity to continue to submit those crash reports. So there's 30 days, the period of time after which a crash, if somebody passes away, then it's considered part of that fatality data. There's also obviously investigations that are done related to drug and alcohol arrests, which takes some time in terms of testing. And so that period gives some additional time. So we don't quite have 2020 data. We normally release that around the March timeframe. Unfortunately, as many of you have heard, even though the number of vehicles on the roadway as a result of the pandemic was lower, we were seeing a lot of speed on the roadways, a lot of single vehicle crashes where in the years prior we had seen more multi-vehicle crashes, but because not as many vehicles, the single vehicle crashes were on the rise. And so unfortunately, we know that the numbers are not moving in the right direction in terms of what happened in 2020. That is fairly consistent with what is occurring across the country as well. Unfortunately, those trends are out there in other places still. So this is a graph that I think is a helpful analysis of the main causes of fatalities. You can see unbelted, 33% of all fatalities, speed, 18%, and then impaired, And we always look at that in this Venn diagram, kind of towards the center there. You can see the number of people that are engaged really in 2 or 3 of those high risk behaviors. And so, what this tells us is we really need to get those dangerous drivers off the roadway because they are not only injuring and killing themselves, but also potentially others as well. And so this helps focus us, obviously, in terms of the main causes of fatality as we work with our partners, as we disseminate highway safety dollars and those kind of things. We want to make sure that we're doing it in a really a data-driven approach. This is our seatbelt use rate numbers. Again, not happy with, we do have 2020. This is something the Maryland Highway Safety Office manages. We do get an independent consultant to go out. They actually do a review of usage, and our methodology has to be approved by the National Highway Traffic Safety Administration. We do counties throughout the state, Baltimore City. We have to do local roads, state roads, a variety of intersections so that we get a good cross sampling. So you can see for the first time, we just dipped below 90%, which is really the mark that states look to stay above. So seatbelt use is really a focus of ours and something we're going to continue to press on. In terms of where we would see the lower rates, it tended to be more on local roads. I think that that thought process is still out there. I'm just taking a short trip. I don't need to be belted. Those unfortunately common ideas are not accurate, as we know that many crashes happen within just a few miles of your home. And so we are reinvigorating that message in terms of seatbelt use, and we're doing some other things working with partners to try to increase that. So this is another thing I thought might be helpful to see in terms of the time of day crashes happen. Some of this might be intuitive to you, that tends to be when it's dark out, and you'll see as we go on to look at pedestrians as well, the same thing obviously holds true. The crashes, and whether it's a fatal crash or a serious injury, that's just how it's rated by the officer at the scene. You tend to see that increase happening during those hours where we have darkness, maybe some more risky behavior occurring if folks are out drinking and that kind of thing. So you can see the time of day here. I thought that would be interesting for you. Okay, and so you can see this is pedestrian data. In a similar way, I wanted to show the main causes of pedestrian crashes. So you can see overall on the right, we mentioned that nearly 85% of the crashes involved not crossing in a crosswalk or intersection, driver distraction, or occurred again at that 6 p.m. to 4 a.m. time frame, when again visibility is clearly an issue. And so you can see how that plays itself out. The driver distraction being about 28%, the time of day about 52%, and about 53% not crossing at a crosswalk or intersection. We are working, the Highway Safety Office is working with the University of Maryland, Baltimore, to really do a deep dive into about 100 pedestrian crashes. We had done this a few years ago, and we found it to be really instructive. We involved the state and the county engineers, as well as the police departments in those crash. Essentially it's a reconstruction of what happened, what are the causes. And we try to use that information in order to figure out how we can improve things going forward. What kind of changes do we need to make? What we clearly saw last time we did it is there are a variety of different causes of these crashes, a variety of different issues involved. And so it really does take kind of that localized solution, and the partners working together to make sure that we're doing everything we can to prevent these from happening. One thing I do want to note, because it probably is not something you traditionally think of as a pedestrian involved fatality, but if somebody exits their vehicle on the side of the roadway, they are then considered a pedestrian. Over the last year or so, we've seen really a rash of these incidents where somebody, and there was just a tragic one last week. There was a car crash. Folks leave the road, the car, they pull over. They leave the car in order to examine the damage, or say they had a flat tire to change the tire. unfortunately, they wound up getting struck and killed. And so we really have been trying to message that as well, that you become a pedestrian as soon as you leave your vehicle. So really, it's not safe to pull over to the side when there's no shoulder or limited shoulder, really encouraging folks to get off the roadway altogether. So I just did want to mention that, because I know it's not something we traditionally think of in that way as a pedestrian crash. That is, however, how we record it. And we're seeing an increasing number of them. And I think people are just not conscious of the fact that when cars are going at high rate of speed, they see somebody there, you know, there is that effect that you tend to look and to see what is happening. Your eyes are drawn to it. And unfortunately, sometimes the vehicle is as well. And obviously, pedestrians, bicyclists, and when you're outside that vehicle, you're so vulnerable to being struck by a vehicle at that point. Okay, so this slide gives you an overview of the total crashes. You can see that 124, so it is a high number of fatalities out of our total fatalities, and it's something that we continue to try to really get our arms around in terms of resolving it. I broke it down here a few ways that I thought might be useful for you. The top 5 jurisdictions in terms of crashes, the locations, and this kind of speaks to the Venn diagram that I showed just before this, the top age groups that we see involved, as well as the time of day, which again, we had talked about a little bit earlier. Again, I do want to emphasize that these are really something that you have, there's not one solution that you can address to each and every one of these type of crashes. You know, crashes that might be happening in Baltimore City versus Prince George's County look very different in nature. And so the solutions that are adopted really, we work with the local jurisdictions in terms of what works best, whether it's law enforcement, whether it's an education campaign. And also, you know, transit, which you mentioned, you know, we've also worked with MTA and some of the local transit providers, because the same thing holds true in terms of, you know, getting out of a car as getting out of a transit vehicle and being in close proximity to the road. So that same messaging about, you know, really being cautious, making sure you're in the sidewalk and the crosswalk areas, those are all still very relevant, and is something that we've partnered together to try to get those messages out. So what is the solution, right? We talked a lot about some of the challenges, some of the problems, and we look at it as building traffic safety. Culture is important. That means it has to be top to bottom. It has to be organizational within, you know, the state. It has to be within the local governments. It also has to be something that the public embraces too. The 4 E's of highway safety you can see on here in terms of enforcement, emergency medical services, engineering, and education. We all work together to try to create an environment so that we're driving down those crashes and reaching that goal of 0 fatalities, which is obviously all of our goal. And now it's the state goal as well, thanks to Shar, who introduced that legislation. And so we are grateful for her involvement in this as well. So I want to talk a little bit about the Maryland Highway Safety Office. It is a division located within MDOT-MBA, and their sole focus is really dedicated to saving lives and preventing injuries. There is a group of experts who are available as a resource. We have folks that go out into the field that work with the local advocates. I want to make sure that you as an elected official are aware of that resource. Certainly it looks a little bit different right now. We're doing mostly online training, obviously for everyone's safety, but during times when hopefully we'll return again to be able to do in-person things. You know, we've got a seatbelt simulator that shows the effect of wearing a seatbelt versus not. We've taken out the high schools. We can take to community events. We certainly have videos of all those things online that they can use in the same way, but a really great resource and a great group of people whose sole focus is really dedicated on ending those fatalities and injuries. And we also work with our federal partners. I mean, that's important as well, obviously, and making sure that we're conscious of other developments that are happening throughout the country. Also, health departments is something we've been focused on. I know they're very busy with other things right now, but they are an important piece of this as well. And so making sure that we are staying in tune with them. They're a great way to get the message out to local communities. And so wanting to make sure that that is happening. We do have a strategic highway safety plan which is how we frame our goals for moving forward. We just adopted our plan. It started January 2021, and that'll take us through December 31st, 2025. So that reflected that Vision Zero fatality goal. Before it was Vision Zero was what we were trying to achieve, and now we've got that as the center of the Strategic Highway Safety Plan. That report gives a sense of where we are. It focuses on our main program areas that we need to be reducing in terms of impairment and speed, distraction, pedestrians, all of those things we need to focus on. And that sets out strategies to how to get there. So the whole goal of the SHSP is really to bring that data together and our key partners and to have a plan. It's not something that sits on the shelf. It's not something we are required to do it by the federal government, but it's something that we do because it's something that we think is important. And obviously that 2030 goal, reaching Vision Zero, is where we are all focused. So this gives you a sense of, I mentioned some of those key areas: speed and aggressive, distracted driving, infrastructure, impaired driving, occupant protection, pedestrians, and bicycles. You can see also in that center some of the high risk groups that we focus on. So whether it's young drivers, that high risk group that we see too often in the crash statistics, or older drivers can have challenges as well. Motorcyclists, obviously, equally not protected, and so that can be a concern. Commercial drivers, and that's something that we've been focused on. We've seen some bad commercial crashes, and we want to make sure we're doing everything there. And obviously transit users, as I discussed earlier. So you can see the 4 E's that are surrounding the circle, and then the things at the bottom in terms of data that feeds into it. Again, we want to have that data-driven approach. We don't want to just be making decisions or putting efforts in areas if that's not really what's going to yield the results. And so it's important that we are taking into account all the information that we can to get to that Vision Zero. And here's a bigger graph of that chart I just reviewed. So one of the things we're really excited about, we've put an emphasis on local jurisdictions developing strategic highway safety plans at the local level. The Highway Safety Office provides support for that. So we provide data, we provide resources. We also have worked with the Baltimore Metropolitan Council, and they actually hired a staff person that was funded by some federal highway dollars that we were able to get from traffic safety. And they funded a position to help the counties in the BMC region to be able to develop plans. And actually that plan that was just developed by Baltimore County came from that effort. So we're really excited about that new development. Other counties have had plans for several years and are in the process of updating their plans, like Prince George's County and Cecil County, as well as Hartford County. So different jurisdictions are in different stages of those plans, but really excited that it has been embraced throughout the state. In addition to counties, we have several cities that have adopted their own plans. As well as several more jurisdictions are in process. So we know that they are working on those plans. We've got folks that are assisting in that regard. And so we look forward to seeing more plans coming out in 2021. Really the goal of these local plans, again, it's to say that, at the end of the day, really local issues are important to take into consideration. What we might look at on a statewide basis as our focus might be very different as you look from jurisdiction to jurisdiction. And so we want to make sure that the local jurisdictions come together to develop these plans. It's still their led effort, even when we offer support. Many of the local jurisdictions who have done this said that the process of developing the plan in and of itself is very helpful in terms of focusing their efforts. And many times, maybe the health department, the police department, we're not talking about highway safety issues. It was just not something that they thought to come to each other and have that conversation about. And so, we have a whole action plan, I should say at this point, that we've put together in terms of how to develop an SHSP. And again, we would support any local jurisdiction that wants to develop one. We're happy to provide any information and guidance that we can, as well as a lot of the jurisdictions who have developed them. They've helped us. We put on some training And a lot of these local jurisdictions who've got more experience have helped to provide information to other jurisdictions who are earlier on in the process. Some of the other things we're doing is really trying to break down barriers that were previously there between infrastructure and behavioral. So obviously, Highway Safety Office, we're looking more at behavioral issues. The State Highway Administration and even the engineers at the local level are more looking at infrastructure. And we really feel like those two need to come together. And so we've got a program where we're working with the engineers from State Highway to exchange resources, essentially, to try to say that those barriers have to be broken down. We have to think about things in a more comprehensive way as we're doing design. And I think the fact that MDOT SHA has developed that context-driven access and mobility for all users is really helpful because they're already thinking in that way now. And again, trying to make sure we take into consideration the safety of all of our roadway users, because that's really our goal. The other thing we're really trying to do, there's a lot of investments made on the roadways, and we really want to try to amplify the benefits of infrastructure improvements, especially if they're aimed at safety, and come behind with education, most importantly, and then enforcement as necessary. You know, sometimes we might put a new traffic signal out there and folks don't know how to use it. And so what are we doing to make sure we're putting out education? You know, if there are needs in the community, making sure it's bilingual. And then bringing law enforcement. If speeding is still an issue in that area, then we need to bring law enforcement and have them as a partner as well. But, you know, again, it's about breaking down those barriers and making sure if we're making, you know, these infrastructure improvements, which are obviously very expensive, there are things that we can do to support that, you know, from an education and enforcement standpoint to make that, you know, so much more effective, we truly believe. So that's what I have for you today. Again, I really appreciate the opportunity to share this information with you and for many of your leadership in this effort. And I'm happy to take any questions you might have.
Thank you so much. If folks want to use the raise hand function, we can do some questions, and we'll start with Delegate Healy. Delegate Healy, you there?
Yeah, I just trying to unmute myself there. Thank you. Yes, I wanted to ask about the engineering aspect of it, because I think that that's getting, that has been very effective in Prince George's County in some places where we've had serious crash issues and especially interaction with pedestrians in College Park, in Riverdale Park, along Kenilworth Avenue, East-West Highway. And even things like putting up fencing so that people will be encouraged and actually funneled into crosswalks rather than trying to cross in the middle of the street. And I guess the question I have is, because I hear that you're trying to do more coordination, but some of the problems that we've had really come from that kind of lack of coordination and understanding human behavior. The people want to get across the street as quickly as possible, and engineering things so that where the bus stops is not a mile from the nearest crosswalk, and that there may be a barrier between the sidewalk and getting across the street, whether or in the middle of the street, like with a tall fencing. Is this ever going to become like a regular thing that gets analyzed when you do road improvements?
So it's a great question, Delegate Healy, and it is something that we are focused on. So we've got those different focus groups that are meeting, and one of those is related to the pedestrian safety one, and they are looking at these intersections and areas. We do location analysis as well. I didn't talk a lot about that, but if we are seeing a lot of crashes in a particular location, we're going to do analysis of that location. Certainly state highway is the lead if it's a state road, and the local jurisdiction if it's a local roadway. But really looking at that, I know exactly what you're talking about. We did a project in Glen Burnie. The transit stop was not aligned with the crosswalk. We moved that. We did some things in the median. I know Greg, even when he was SHA administrator, was really instrumental in reducing the speed on some of those roadways.
Absolutely.
And so I think all of that is a part of it. It's hard to do that. You kind of have to focus on that area. So it is an area at a time, and it is as we're making enhancements, or as if we identify that it needs, more quickly to be looked at. But certainly I'll tell you that is the mentality, and that's how we're going about it. It may take some time to get there, but that is.
Yeah. One other issue that is with that is that if you're dealing with MTA, that's one of your agencies. But if you're dealing with WMATA, and they're hard to get to relocate their bus stops and so forth. And I would hope that, we can be helpful in that the General Assembly can be helpful in maybe helping you to get the kind of memorandum of understanding or something that you can coordinate. I know that State Highway did a project in my district, and that was one of the issues when they were doing it, was locating the crosswalks near the bus stops, because if people walk a mile, they're not going to, they might walk a quarter mile, but they're not going to walk a mile to get to the nearest crosswalk. So I think we need to think proactively about that before, so that we don't have these kind of fatalities.
I agree. Well, WMATA is an important partner, especially in the Washington area. And yeah, we'll certainly see if there's additional things we can do to strengthen that partnership. Certainly if it's a local jurisdiction bus stop, it's a little bit easier because they're generally, we're working with them as a partner, but we can look at the WMATA issue as well.
Thank you.
Secretary Slater is now on the board of WMATA, so
that's right. He's got
to encourage that partnership. Delegate Lewis.
Thank you. Thank you, Delegate. Good morning, everyone. Ms. Neiser, you did a great job. Thank you for that presentation. It was really informative. I learned a ton. I do have a couple questions, though. Wouldn't be much of a briefing if we didn't have questions for you.
Sure.
Two things. First, I noticed that in the safety plan sort of framework you described, I didn't see complete streets mentioned as a strategy for improving safety, road safety. Maryland has complete streets statewide legislation, a grant program, as well as a policy platform. And some local jurisdictions like Baltimore City also have complete streets plans. I wondered if you could mention that oversight. Did I just miss it? Or is not seeing complete streets as a useful tool? That's my first question, then I'll follow up with the second one.
Certainly, and I'm sorry, Delegate, it is certainly a useful tool, I agree, and maybe an oversight on my part. It's probably the next level down. So each of those, as you saw that circle there, has strategies to meet their goals. So like the infrastructures where complete streets would fall as they look at, what changes they should be making from an infrastructure standpoint. And again, that complete street view takes all of our roadway users into account, regardless of bicycles, pedestrians, transit users, and vehicles. So yes, it would be in that next layer down, which I didn't get into, but I'm happy to share the whole plan with everybody if you'd like to see it.
That could be really useful. And the idea of complete streets, it's an important concept for members of the legislature to really absorb. A complete street strategies would solve the problem if they were applied correctly and uniformly, would solve the problem of bus stops being a mile away from a crosswalk, which is what Delegate Healy was getting at. Complete, if we applied those principles, we'll get there. So thank you for that. I'd love to see the report. And then my second question was, you made it clear that decisions made to promote safety are grounded in data. You talked about data-driven designs and solutions. And what I'd love to know is if you have access to data about most vulnerable people, humans, who are more likely to get harmed on our roadways. And the most vulnerable, we know from national information, is that Native Americans, African Americans, Latinos, and the elderly are more likely to be harmed. Do you have access to that kind of racial and ethnic data or not?
So certainly we look at census data, and I will say this is where the health department as a partner has been helpful because they do a lot of analysis in terms of vulnerable communities. I still think we need to do a better job in terms of making sure the education piece in particular makes its way to all communities. Again, I think we've done it on individual local basis, especially where we've seen more crashes and fatalities. But I agree that's an area we need to continue to focus on to make sure we're getting that message out there, because if we're not speaking to the communities in the right way, then it's really not being effective.
I take your point. Education is important, but what we know from national data is that there is very little difference between African Americans, Native Americans, and Latinos who are harmed in crashes than white people. So it's not really, it really doesn't come down to education, but more design. If you had access to racial and ethnic data, would that help you in your process for planning and recommendations? Do you need that? Because I actually have a bill to require the state to capture and share racial and ethnic data. We literally don't do that now. So we have no idea whether Blacks and Latinos are more harmed, where they're more at risk, et cetera. It really comes down to race, not education. Would that be helpful to you?
Yes, I am familiar with your bill, and yeah, we generally follow in terms of crash reports what the national standards are. That's not currently, one of, as you well know, is not currently on that as being required to be collected. Certainly, we have the ability after the crash to be able to connect things like motor vehicle data and other data. And so there's other ways that we can still get about that, not only from an education standpoint, but to your point, from an engineering standpoint, as decisions are made in terms of what enhancements are being made. So there are other ways that we can access the data, but yeah, I'm familiar with the bill that you introduced as well.
Thank you so much. Thank you.
You Delegate Lewis, Delegate Solomon.
Thanks, Mr. Chair. Chrissy, it's good to see you. Thanks for being here. And I just have to say from the get-go, thank you for being so responsive on so many constituent issues that have come up this past year. Really appreciate your responsiveness. And, I think there has been a marked shift within MDOT and SHA and MBA on pedestrian safety issues. We've had a really great working relationship with the whole team on a lot of issues in our district. I guess my question is sort of more of a broader one, and I know budgets are always tight everywhere. And I guess I'm sort of curious. I always like to pick Greg's brain on this too. We've had a really good working relationship with sort of smaller issues that can be addressed with maybe new paint or a new sign. But, for a lot of places where, frankly, the whole sidewalk needs to be reconstructed or an entire intersection needs to be rebuilt, or even a hawk signal needs to be installed where, there just isn't quite the budget yet. We can't fix this overnight because this is, decades of infrastructure that cost billions of dollars. But I just don't know sort of if you have thoughts or if there's been discussion within the agency of sort of a longer term solution around funding to, be able to get us to a place where we're not fixing, 10 sidewalks a year, where we can be more proactive instead of sort of saying, oh, there's been an accident here, let's now expedite this fix, as opposed to saying, we know that this intersection or this sidewalk has been dangerous for 10 years. Fortunately, nobody's been killed there yet, but it's just down on the list because we don't have any money. Any thoughts on sort of fixing that budget issue or finding new resources?
Yeah, I will say we get highway safety dollars from the federal government, but those are only for behavioral things, and I think you're aware of those. So we get between $9 and $11 million a year. So I just want to make sure everybody's aware of those because they do go directly to law enforcement and advocacy groups at the local level. So I want to encourage everybody, if your advocates are not applying for that funding, please have them apply. We'd love to have new partners. In terms of really focusing on safety improvements, one new thing, it's not a new dollar, but it is a new approach that State Highway Administration is taking, is really encouraging local jurisdictions to develop those local strategic highway safety plans and essentially giving preference, I'll say, to jurisdictions who have developed those plans, who have strategies themselves, because a lot of the dollars that comes to SHA from the Federal Highway Administration is targeted at safety improvements. So making sure we have that clear nexus between the dollars that are coming from the federal government to those safety projects that you're referring to. So that is new within the last 6 months, and State Highway Administration has started talking to the local county engineers about this approach. So I know it has, for the jurisdictions that are not don't have plans in place, it has now gotten a little bit more interest because they recognize that there may be dollars that are attached to it. And I think that's a really important signal, because it's one thing for us to be out there saying that these plans are important. It's another thing to say, we're going to prioritize our funding based on, you know, these real safety enhancements that need to be made. So it's not new dollars, but I think the prioritization is important.
Thanks. And one last thing I'll mention, just it's a somewhat parochial concern, certainly for those of us in Montgomery and Prince George's, and I try to mention it whenever I can. And I think we've made some improvements, but certainly with you know, with the eventual completion of the Purple Line and the fact that those stations don't have parking, and it's built specifically that way, just really continuing to emphasize and making sure, especially when the new contractor comes on board, you know, that there is more of a coordination between pedestrian safety issues and frankly sidewalk construction in places where we want neighbors and you know, communities to be able to access the Purple Line.
Definitely aware of those, and had conversations with Kevin Quinn and you know, the folks at SHA about that. So we'll continue to definitely keep that on the top of our radar as things move forward with the Purple Line. But thank you for that.
Great, thank you, Chrissy. Thanks, Mr. Chair.
So she's Chrissy, but I'm Mr. Chair. That's interesting. You can call me Mark, Jared. Delegate Charkoudian.
Thank you, Mr. Chair, and hello, Administrator Nizer. How are you?
Good to see you.
Thanks for being here. I have a couple follow-up questions. Some of them got answered, but I think this idea of engineering for safety, I mean, I'm thrilled to see it everywhere. I've certainly been talking to the Secretary over the last few years, and when he moved kind of from SHA to head of MDOT, and that's all really exciting. But I don't feel like we've seen it quite yet in the designs as they're playing out at the local level. And I can give you sort of two specific examples. One is on Route 29 in Oakleaf Drive, and there's some construction, there's some work that's being done on that intersection. And it's an area that's been on my radar that I've been reaching out to SHA about in terms of the need for a crosswalk there. And there's a neighborhood on one side and a bus stop on the other side. So this piece that we've been talking about, and this entire design process happened, and now apparently it's gone too far to be able to back up and you know, put that crosswalk into it. And I just can't imagine how this whole process happened. You know, like if this is in fact the lens with which the department is now looking at all of the design work, I don't understand how this entire thing happened without that being a priority. Similarly, as we've looked at the, you know, we've had people killed along University Avenue. I've done some of these safety walks with your colleagues in leadership, and you know, when we've pointed out some of the challenges, the solutions that folks came up with was to remove bus stops. So to take people who already have a difficult life, who are already transit dependent, who are already walking too far, who already have lost their trees, and now we'll make them walk farther rather than to put in crosswalks. And so it's just, I'm not seeing it yet in the localized decision making, and I'm not sure where that disconnect is. I think some of it is definitely funding, to Delegate Solomon's point about how do we sort of not have it be piecemeal, one crosswalk a year. But the other is, even in these places where it seems that there is an effort, something is being done, it's just, I'm not seeing that lens in the local decision making. And I don't know what it actually takes for it to kind of come from the vision of the department on down. And I want to be supportive, work very closely with our local District 3 SHA folks, but I'm not sure, it is frustrating. It's especially frustrating. We, you know, on Saturday, I'll be at another memorial for a constituent that we lost. You're welcome to join us. It's on New Hampshire in Hillendale. But we just keep going to these memorials and keep begging, and you know, we're just not seeing the change in the reality of the local design work.
Yeah, I'll follow up on that specific example with Tim Smith. I don't know if you talked to him about that one already. You have? Okay. I do think.
So he's now re-looking at it. Like, okay, I did talk to him, he's re-looking at it. But my question is, why wasn't it done in the first place? Like, why did it take me going to Tim Smith to say, like, how'd you miss this crosswalk here? Why wasn't the original design looking at it from that perspective of not just moving cars, which is what the new design does better, but also moving people?
Yeah, and I think you have a great point about the cultural change. This is a shift, right? And this is unfortunately difficult. And I think the district offices are the key places where we need to have that change. And that's one of the reasons we're doing this kind of exchange with the behavioral folks and the engineering folks in the district offices, because I think that's really, no pun intended, but where the rubber meets the road in terms of these decisions. We've got to get a shift at that particular level in order to make a difference. I'm not sure if those plans were in place from years ago before that the change had kind of been made, because often these engineering decisions, the plans are done years in advance of when actual construction dollars come. So for that one in particular, I'm not sure, but I agree with you. This is something that's going to take some time to shift. I know we don't have time, and I share the same frustration that every day something doesn't get modified, there's the potential we lose another Marylander on our roadways. So I share that lack of, we need an urgency about it at the local level. And frankly, I think there's been a lot of changes in leadership at the district level, which is a good thing, to get folks that maybe share that same philosophy of making these changes proactively as opposed to waiting for things to happen.
Thank you.
Delegate Charkoudian, Delegate Hill.
All right. Thank you, Mr. Chairman. Thank you, Administrator Neiser. This is sort of directly and peripherally related. I've been concerned about what I consider a real lack of retroreflectivity in the road markings that I think are, contributing not only to non-pedestrian accidents, but to pedestrian involved accidents as well. So our state does a great job with our signage. So the signage has great retroreflectivity, but not our state roads, our local roads, county roads. It's really horrible, and it hasn't gotten better. It's a conversation I had with the department about 6 years ago, just casually. And I'm wondering, when you talk about safe highways and an integrated plan, if that is getting any weight at all.
So there certainly are standards that reflectivity is supposed to meet. Those are set at the national level. And so I know that State Highway Administration does regular reviews of the roadway materials to make sure they are meeting those standards and making, enhancements if they're not. I'm certainly happy to go back. It is something that certainly we recognize as well, that reflectivity is important in terms of folks, knowing where the roadway goes to, especially if it's something they're unfamiliar with, maybe they haven't traveled there a lot. I'll certainly follow up with Tim Smith and see if there are additional measures that they're taking.
I don't think, I think the issue is that the federal standards are really not adequate. And so if all we're doing is meeting federal standards, and all of us can drive at night, whether it's rainy or not, and we know that the road markings disappear. And if you travel to any of several other states, even on a backcountry road where there are no lights, no other cars on the road, you get tremendous retroreflectivity. And you can see the road markings on foggy nights, wet nights. That's just not the standard in Maryland. So I guess the question is that all we're doing is trying to meet whatever minimal federal standards, or are we actually looking at it and see if we're doing the best we can? Because that tends to be a relatively inexpensive improvement, as I understand it, to our overall.
Yeah, let me follow up for you on that one. I'm not sure exactly the measures are taken, since that generally falls more under SHA, but we'll get you a response. I'll make sure that we get you an answer on that.
Thank you.
Delegate Polakovich.
Mr. Chair, thank you, Secretary Neiser, for being here and for the presentation. I wanted to continue on the line of questioning that Delegate Solomon and Delegate Charkoudian brought up about kind of the cultural changes within the department as Vision Zero continues to be implemented. So first of all, I appreciate that there have been new data sets that have been collected and publicly released as you all have been implementing the law over this last year and a few months. And that's great to see. And it's very encouraging to hear about how funding decisions are going to be that'll be a factor in terms of prioritizing areas based on actual crash data. I'm curious if there's other things that you can point to that have been implemented or you're hoping to implement in the foreseeable future to continue that kind of change and more move towards data-driven approach in terms of identifying problematic areas and actually prioritizing funding for that.
Yeah, I'm really excited. We actually applied for and were granted through NHTSA to have what they call a GO team come into Maryland and really look at our crash data and how we can make it more accessible to the public, how we can kind of break down some of the barriers that tend to exist. And so I know you're familiar, but just for everybody's benefit, MSP is the custodian of record under the law. Highway Safety Office is a great user of the data. State Highway Administration uses it for different purposes. And then you've got all the locals. And unfortunately, there's not great data, as you know, out there for folks to be able to access. So we're bringing in experts from throughout the country. We actually had a meeting last week as a kickoff for that effort. The good thing is at this point, we've got Secretary Slater, as well as our Colonel of State Police, who are really committed to say, let's figure out the best approach for Maryland. Let's not worry about, whether it's one agency or another agency. Let's bring in the experts and let them tell us how we move forward as an organization. So that effort will be happening over the next several months, and I'm happy to certainly keep you updated. But these are issues that have been around as long as I've been around the community, and it's exciting to see. And I think the leadership being in agreement of, not getting embedded in these kind of territorial issues really has helped move it to this next spot. So I'm looking forward to participating in that effort, and then the outcome, that the report that we'll get at the end, which essentially should be then a guide that we can follow moving forward.
Thank you. And a sense of the time frame for that effort and when the report might be expected? I'm guessing not very soon, but are we talking a year or?
No, about a 6-month effort, it sounds like. So hopefully we'll have some, recommendations by summertime.
Thank you.
Thanks.
Thank you. I'll just note that the idea for this briefing was Delegate Palakovich-Carr, so thank you.
She's been a great leader in this. Oh, I'm sorry to interrupt you, but she's been a great leader in this area, certainly, and we appreciate her support.
Delegate Tarraso?
Yeah, thank you, Mr. Chair and Administrator Neiser. You mentioned an uptick in the fatalities or injuries along highways, which is a great concern to me. And I know that Delegate Palakovich-Carr had a bill, and then I had one last year in terms of, move over bill. Do you have suggestions on what can be done? Because obviously you can't do anything about if your car breaks down or if you're, get a flat tire. And so those are very concerning to me.
Yeah, we actually did a multi-agency effort on this. So we got together the Maryland State Police, SHA and MDTA, as well as ourselves, to kind of put together recommendations, because you're right, there's so many different roadway conditions. I can see why a driver would be confused in terms of what should I do if I'm confronted with an emergency situation. That guide might be helpful to provide to you all, that you could share with your constituents. I would love that, because we continue to unfortunately see these tragic situations happen. So there's a whole series of kind of recommendations of what steps you should take depending on where you are and what the environment is like around you. So if you're interested, I'd be happy to provide that to you.
So your thought is about education, and there's not, I guess my concern is that now I appreciate it, and I'd like to get that information out to my constituents, obviously, but my concern is that it's a long way to educating everybody about every different road type. And is there something that can be done policy-wise or infrastructure-wise, legislative-wise, in terms of averting some of those fatalities? What can be done, or is there a simplified message on that?
Yeah, unfortunately, I don't think we tried to come up with a simplified message, and it doesn't lend itself to that, unfortunately. I know the department's always been supportive of the move over laws and making sure that, we're protecting those highway workers, which they continue, unfortunately, to get struck on the roadways. And so certainly that is one legislative effort that I know, has continued to move forward and be successful in drawing attention to the issue. But many of the, and certainly that is a very real issue, but many of the recent fatalities that we've seen on the roadways have been drivers who are just, exiting their vehicle for a variety of legitimate reasons, but unfortunately putting themselves into harm's way as a result.
Thank you.
Thank you.
Delegate Tarraso. Looks like our last question is Delegate Lehman.
Thank you. Great discussion. I was wondering, and I'm not sure who I should ask this question of, but on the issue of more revenue for sidewalks, either sidewalk repair or new sidewalks, I wonder about the possibility of designating a certain percentage of speed camera revenue to that for that purpose. I know in municipalities, I've had conversations with Laurel Mayor Craig Moe. You know, in the city, some people have criticized Laurel for its overuse of speed cameras and red light cameras. And in a conversation with me a few years ago, he said, well, you know, the good thing we're doing with that revenue, you know, we're aware of people, you know, criticizing government, saying it's a money grab, but he said, we are using that revenue to make really important public safety improvements. That's what we're required to do with that revenue. I know that, you know, budget folks don't like when we sort of tie their hands with, you know, being overly prescriptive with how we spend revenue. But that thought occurs to me. Does anyone have any feedback or comments on that idea?
So certainly, I think there could be a legislative. I think you'd have to direct legislatively if you wanted, you know, a portion of that revenue to go to a specific purpose. That would be something that would have to happen, you know, either at the statewide or the local level.
And would that, thank you. And I figured that, would that, I can talk to some colleagues offline about whether that would make more sense as a statewide bill or as enabling legislation. I don't think they have that much flexibility though, but I could look into it as, you know, to treat it as a local decision. I might be wrong about that.
I don't think so. I don't believe so, but I'd have to look at the statute.
Okay, thank you.
Thank you, Delegate Lehman. That appears to be all the questions we have. Thank you so much. I think it was a great discussion, your presentation. We appreciate it, and a great discussion with all the questions from my colleagues. Everybody, we have our next meeting a week from today on the Regional Transit Plan for Central Maryland. So 11 a.m. next Monday, and I will see many of you on Zoom boxes many times between now and then. Thank you all again, and thank you again, Chrissy, for joining us.
Thank you. Thank you.
Thank you. Goodbye.
Thank you.